Welcome to Bodies, Borders, and Breakthroughs, your podcast for a deep dive into the minds shaping global health professions education. In this episode, we will be exploring the work of Dr. Rashmi Kusurkar, a leading scholar in health professions education whose research centers on the question, how do we develop students for life? Her work exists at the intersection of motivation theory, equity, and professional identity, spanning borders, disciplines, and cultures, from advancing self-determination theory in education to addressing access, diversity, and inclusion in healthcare training. Dr. Kursakar's work is imaginative, open-minded, and inclusive. We're so thrilled and excited to have you with us today, Rashmi. We know that medical education is a very new, fairly compared to other fields. Where did the spark for medical education come from that drew you? Sounds like the fire that lit you from India to the Netherlands, even prompted you to learn or to speak Dutch. The fire seems to be education.
Yes.
For you. Does that come from your personal history? Does that come from your own passion? Where's that fire for education come from?
What I can tell you is that I was very keen to do research. So when I did my MD physiology, so I'm a medical doctor by background. I did my specialization in physiology. And when I was doing that, I did a lot of research. Unfortunately, I was not able to get this published, this research, and this was research in physiology. So the desire to do research was what really pulled me to physiology. I was fascinated by the topic because it is how does the body function normally? That is physiology. It was fascinating for me as a topic. That's why I took up the specialization, and I wanted to do human research, like what happens to the body when you do yoga, what happens when you neonates when they are given touch therapy, how does the physiological responses and emotional and psychological, how do they develop? Those were the kind of projects that I was working on during my MD, and I worked on. Physiological aspects and psychological aspects of children with learning disabilities. That was my MD thesis. So the desire to that for me that was the intellectual challenge of doing research and doing meaningful research which is relevant to the society. That is why I decided to do an MD in physiology. And when you do your MD, you do a lot of teaching. So that was my first experience with teaching. When I started my MD, I immediately started teaching students practicals, and your physical examination is also taught in India in the first year. So I was a physiologist and I taught physical examination and everything about the body. And I was also taking lectures. So I really developed an interest in it. And for me, the interaction with students, that is what gives me energy. So I was really fueled by that. And after my MD, I wanted to do physiology research. But in India, I didn't have the funds. I didn't have access to the right resources in terms of journals, etc. So I couldn't do cutting edge research. And that is what really, like, I was frustrated in the sense that I want to do research. I love the teaching, but I do want to challenge myself beyond teaching, but I was not able to do that. And then I followed this course on medical education, the pedagogy and the formats of teaching and the content of teaching, etc. And I was fascinated because I had never thought about it before. I think I was, before I did the course, also, I considered myself a good teacher, especially because of the feedback from students. But this opened up a new world for me. And then I thought, okay, first of all, this is very interesting. I find it very interesting. And the other thing is that I don't need the kind of funding that I need for physiology research to do teaching research on teaching learning processes. I can do it in my own time. I don't require a lot of money for it. And that fueled me to go further into it. So I gave first I trained myself, then I myself conducted faculty trainings at our institution and university level. And I got more and more into the educational world. And there I, with every the fellowship that I did a small project, and then we had to, analyze and everything. So I learned the research process, but it was still not at a very high level. And then I felt like, okay, I really want to do research. And I don't know whether you have heard about FAMR. I was a FAMR
Yes.
fellow. So GSMC, that's a regional institute in Mumbai, GSMC FAMR Regional Institute. I did my fellowship there. And there, when we had the concluding day of our fellowship, there was a wish list board that we had, and everyone was supposed to write what do they want to achieve or what dreams they have. And there I wrote, I want to do a PhD in medical education. And you
Oh,
won't believe it,
wow.
but everyone, including the facilitators, laughed at me.
Oh,
Because at
wow.
that point in time, it was not possible to do PhD in medical education in India. And it was a dream that I had, and I put it down, and everyone was like, oh, this is impossible. I mean, what are you even expecting from yourself?
So now I'm
And
getting chills
yeah,
because I got the answer, right? Carry
and
on.
then it was coincidental that my husband was looking for a job which would, really intellectually also be challenging for him. So it was, he
Yes,
said, okay, now I have enough experience in Asia. I would like to do
yeah,
something in Europe. And that's
yeah.
how we went to Amsterdam. And there, then I thought, okay, now I want to look for a PhD. And I started my search. I started with knowing no one. Yeah, it was really, it was a miracle that I found something, I should say.
The body's part of our podcast is reflecting not just, I mean, as a physiologist and a specialist in that field, you think of the body as something physical. But in social sciences, we also think of the body as being part of the identity and who we are. And so far, you've been reflecting on that. And, the, with all the languages that you speak, I don't know if you've come across this phrase, thick-skinned, where you don't let the arrows pierce your skin. You let them kind of prompt you in the right direction. So that's one of your identities as a formidable researcher. You take risks, you take critique and you turn it in on itself. You take challenges and pull them together from different directions. You maintain a passion for your work, and you're interested. You don't let imagined or real barriers stand in your way. Saying that you want a PhD and a whole room laughing at you is like, well, I know who I am. You might know what the world is, but I know who I am. And just because this barrier exists in the world doesn't mean that I can't overcome it. So let's talk a little bit about your research. And at the core of your research is the self-motivation, and how students are able to motivate themselves in the very challenging world of medical education research. But then you also bring in this by the cultural aspect and the international aspect of leveling the northern tilt and encouraging equity in health professions education. Can you talk a little bit about that?
So there are two aspects to it. When I say that I let the personal and professional mix, that has
Mm-hmm,
also influenced my research. I
mm-hmm,
began with the questions that brought me from, I took with me from India.
mm-hmm,
Those were on motivation. And then along the way, I had so many experiences. So after I had finished my PhD research and I was talking about it with other people, they would say, oh, but that was in India, right? We have
mm-hmm.
completely different students. That's not relevant in the Netherlands. I thought, how can it be so that students in India are not, the experience that I have there is not totally unrelevant in the Netherlands. There can be differences, there can be similarities, but sometimes people just stopped at saying, oh, that's a completely different context, we don't identify. And then people said, the motivation of Indian students comes from pressure from parents. And that's what really put me off. I thought, why would you have such a stereotypical view about everyone, right? And then I thought, okay, I want to investigate this. So then
Mhm.
I went to study academic motivation and a performance of students from ethnic minority backgrounds because I thought, I'm sure this is a uh, topic in this society. But I applied for a grant and they didn't even consider this to be a topic. I was still able to have a PhD student on it, and she completed. And then our research actually led to questions in it's called the Tweede Kamer, that is the
Second
House of
row.
Commons.
Okay.
House of Commons. So in the
Okay.
government,
Hmm.
our research, which no one thought was worthy of getting a grant, actually led to questions in the House of Commons.
That's
So that's
amazing.
yeah, so that so it's, like, so what I bring, the international perspective and
Yeah.
from the minority experience, and
Yeah.
I allow that to mix together, and that led
Right.
me to new research questions.
Mm.
And so we
Right.
did a lot of work, and then when we were doing this research, we also found how ethnic minority students have experiences of exclusion. So we looked also at the leaky pipeline in medical education. So how ethnic minority students, not only ethnic minority students from lower socioeconomic status or people with lower educational level of parents, how they are not able to get similar opportunities. So how there is a leaky pipeline and where
Mm-hmm.
those leaks are, we were able to substantiate it with numbers. So we,
Mm-hmm.
one of my students, Liana Mulder, she is going to do her finish her PhD in on 19th of May. She's defending
Oh,
her thesis,
lovely.
and in her thesis on a big in a big quantitative based study, she was able to show we were able to show that how the pipeline from childhood to medical specialist is leaky, and
Mm-hmm.
which talents leak, and
Mm-hmm.
that received so much media attention that led to a whole new debate on selection versus lottery in the Netherlands, again questions in the House of Commons. So our research has had a lot of impact, and all this comes from coming with a new point of view. Because in
Mm-hmm.
India, I have seen that there are systems where you can there's a quota system, for example, for people who were oppressed, right? In the
Yes,
Netherlands, according to legally in the Netherlands, according to the law, you cannot have a quota system. You cannot
yes,
do positive discrimination. So I came with a new idea because I
yes.
have seen it in India and it can work here.
So you have a fresh lens, you have a polished lens from a different perspective. That's one thing, but you dare to use it.
Yes.
I
Even
think,
if people, as you said before, I had never thought about it myself, that when people tell me this is wrong and I think that it is not, then I still have the determination to go forward and show that it's not to show others, to for me to find out, to investigate, is this really true or is it not?
yeah.
So
So
that's how I see it.
you constantly have to hold your intersectional identity in mind
Yes,
and adjust and adjust. And sometimes you're doing it reflexively, sometimes you're doing it unconsciously, but you can always step back and say, that's what the motivation is behind doing that, because you're doing it intentionally, even though it's not conscious all the time, it's intentional. So you know why you're doing things all the time.
I think so.
So where is this work? And I don't want to separate you from your work. Where is your work taking you in the future, and where are you taking your work in the future?
So, after becoming a professor, the societal relevance or societal responsibility part of my work has really gone, how do you say, it's really gone,
Escalated.
it has
Escalated.
escalated, which is great because,
Mhm,
and I knew this, but I didn't know it would be so strong.
mhm,
The reason why I wanted to become a professor was because it opens doors of opportunities. I did not realize, one, when people see me, they immediately see how hard it must have been for me to come here.
mhm,
So I get all kinds of reactions, right, from people:
mhm,
awe,
mhm,
admiration, respect, etc. And I have received so many invitations in the last 2 years. I've given so many keynotes all over the Netherlands because people really want to work on this topic. They
mhm,
really want to create inclusive learning environments. And then, one, the acceptance is very high because, one, I'm a medical doctor, that somehow increases your
mhm,
acceptance.
mhm,
Second, I'm a professor. And
mhm,
when I stand there and talk about equity, diversity, inclusion, people really take me seriously. So the
mhm.
professor position has helped me to, I say, increase my impact by 100 times.
Right.
So I'm very happy that I got the chance to become a professor so that I could spread the word of being inclusive around. That is
Right.
one. Second is the other work that I'm doing right now is about leveling the global north-south tilt.
Mhm,
I am an associate editor for Medical Teacher.
mhm,
So when Professor Ronald Harden was the editor in chief, he actually brought me on as an
mhm,
associate editor on equity, diversity, inclusion. Medical
mhm,
Teacher receives manuscripts from all over the world, and
mhm,
his vision was that we would like to increase the publication from the global south. So I was brought on specifically. We had an editorial that came out sometime last year,
mhm. I
and
read
then
that.
now we have a new, yeah, and now we have a new editor in chief, that is Professor Jennifer Cleland. She's
Mhm,
also a KI Prime winner actually from
mhm,
last year.
mhm. We actually
And
interviewed
under
her
her
earlier this
leadership,
week.
You are?
We interviewed her earlier this week.
Oh, okay. So she comes with new energy and new vision. So
Hmm.
under her leadership, I'm able to progress this initiative further. So I've been handling many Global South manuscripts, and actually now they are in the publication phase. So I'm very happy about that, that I can channel my work through medical teacher. And I was able to add a lot to reviewers. I was able to add a lot, I mean, reviewer instructions,
Hmm.
a lot to author instructions. I was able to
Hmm.
influence a lot of things on how
Hmm.
to get people, how, for example, I'll give you an example of people
Hmm.
cover only the global north literature as state of the art literature when they write a paper.
Hmm.
So
Hmm.
in the reviewer instructions and in the for the associate editors, I said we need to have literature. When you say international, it really needs to be international.
Right.
It can't be only
Right.
from the US, only from Australia, only from the global
Right.
north. It should actually cover all regions. And those kind of
Right.
ideas I'm able to bring in, and Jen is able to actually put them into practice.
Right. Great.
So I'm really happy about how we are progressing with this on medical teacher. So I'm
Hmm.
very happy that I have this opportunity to actually do this work. I have done lots of workshops, symposia. We have done a symposium together for Amy. In
Yes.
Amy, I have done a lot of this work, making sure that for the plenaries we have people from global south, and so the
Yeah.
awareness of really being international, which means that global south also has needs to be represented.
Yeah.
That work I have been able to do as part of the Amy executive committee, and on medical teacher, and overall in my work. So that's the work
So,
that drives me.
if you're speaking to someone who was you 20 years ago, what would you say to them?
Follow your dreams. Don't let anyone tell you you can't do something. Simple.
No, very
That's what I
simple.
have followed.
That's
Yeah, you
true.
have to
Oh,
believe in yourself and you have to keep moving forward. And I would
yes.
also like to say something after so many years of hearing this. Sometimes I get the question, aren't you too ambitious? I mean, I do not understand that question. Is there a problem in being ambitious? Yes, I am. I am ambitious and I'm not apologetic about it. Take that.
Good. Well, I might use that one. Rashmi, thank you so very much for making the time which is a very, very busy schedule to speak to me and to speak to us. I really think that your words, your ideas, and more than anything, your presence, just in how you articulate who you are and what you've done and the journey that you've gone through will resonate with so many people that I know. You've been an inspiration to me and a good friend and such an ideas person. So I'm so excited to be able to take your voice and your ideas out to the world and like refer so many people to like listen to Professor Kursger. She is so a voice to listen to and to follow. So thank you very, very, very much for your time today.
Thanks for inviting me. And I don't think of myself as Professor Kusurkar. I think I'm still Rashmi. I did this, what work I did before I became a professor, I do the same work. It just means different things to people now. So I still,
Okay.
that's, I think, very important that you remain the person that you are and keep doing the things that you believe in. For example, the global north south, till I brought it to everyone's attention in Amy, it was really not a topic. So
Yes,
I think
true.
even, I mean, dare to do things that you believe in and are different, even if the whole world is against it.
Yeah, show yourself.
Yes, because if you think your ideas are built on something that is an experience, or
Mhm.
you really believe that it is, yeah, you're on the right track, then you should go for it, not let others let you down.